Hi, What the HealthTech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice across health and social care. This week, I'm joined by two special guests, Katy Fisher and Kayleigh Barnett. Katy is a senior nurse for quality and improvement working across the whole of the Greater Manchester region, while Kayleigh is an advanced Appreciative Inquiry practitioner and the co-author of a recent book, Appreciating Health and Care, which provides a practical guide to using appreciative inquiry into health-related settings. Together, Katy and Kayleigh also co-host the Caring Corner Appreciative Inquiry podcast. So they're here today to discuss how appreciative governance and the concept and impact of utilising appreciative inquiry and how it can revolutionise patient and staff outcomes within healthcare. So welcome to the podcast, both of you.
Thank you. It's an honour to be a guest today.
Amazing. Right, okay, we'll get straight into it. So I thought firstly it might be worth introducing yourselves and your roles and your involvement in appreciative governance. So Katy, can I start with you if you want to introduce yourself?
Yeah, sure. Although appreciative governance is still a concept that we still need to build all together. So I will talk about my role in that though. So I am a senior nurse across the Greater Manchester region. I've been a nurse for around 20 years now. I've been in care career for around 22 years. I was working in patient safety and clinical governance and quality and risk. And I'm also the co-host and founder of Caring Corner podcast and website as well, which I'm very, very proud of. So my involvement in appreciative inquiry in relation to clinical governance and patient safety is that I worked for many years in clinical governance, which is sometimes a dark, dark place to work. You're dealing with a lot of sensitive information. You're dealing with a lot of distressed patients or carers. And for me, there was a lot of glimmers of hope working in clinical governance that we couldn't measure and we couldn't identify easily. And I felt that was missing a trick. And I also wanted to support the health and well-being of my staff in the clinical governance team and department. And I started to look for the good. And at that time, met Kayleigh. And Kayleigh had worked extensively in appreciative inquiry, and she knew what I was trying to do, and I didn't know that was the name of what I was trying to do. So I tried to start to build appreciative inquiry in patient safety and clinical governance then. So that was our start of our journey, really. Yeah.
Fantastic. I know we're going to go into a bit about appreciative inquiry straight after this. So Kayleigh, do you want to introduce yourself and then maybe go into a little bit more about what is appreciative inquiry?
Yeah, just to warn you, I could talk literally for days about what is appreciative inquiry, so you might have to rein me in a little bit. So I am Kayleigh. I've been working in the NHS for my whole career, so 20 years. I'll let you figure out what age I joined. And worked in a number of roles across the NHS, starting out, coming out of school not knowing what I wanted to do, so got a job signing records while I decide what I want to do kind of job, and I'm still here 20 years later. So I worked across IT services, project management, and then moved into improvement around 10 years ago, and that's where I discovered appreciative inquiry. And it's fair to say that once I discovered appreciative inquiry, it not only changed my career path and my working world, but also my kind of home life as well. So it's not just a work thing, appreciative inquiry. It's something that can bring a lot of kind of different structure and different belief systems at home as well. So to kind of give a little bit of background to my experience of appreciative inquiry, as I say, I kind of found it around about 9 years ago through a session that I was voluntold to go on. I think it's safe to say that it was not my preference to go on this session originally, with the team from Appreciating People, who are absolute pioneers in appreciative inquiry and have really spearheaded the movement into health and social care as well. So, and then at the end of that session was told, oh, by the way, you're going to be leading our appreciative inquiry theme at this organisation. So I hope you paid attention, which I had not. So a real kind of steep, but I think it's important, to be honest. a real important and steep learning curve for me. But during like the third session that I ran with Appreciating People, I had a real light bulb moment where I suddenly realised that this is kind of what I've been looking for all my life to help me to overcome my negative mindset and my way of kind of looking at the world through. I'm not sure what the opposite of rose-tinted glasses are, but that's what I had. And I often say people talk about a glass half full, glass half empty person. I was a puddle on the floor person before I found Appreciative Inquiry. I didn't have a glass.
Oh, wow.
So it's completely changed my outlook, as I say, both in work and at home. And to go into that you were saying around what is Appreciative Inquiry, that provides a perfect segue into that, because actually what it is, it's a heart set and it's a mindset and it's a way of looking at the world through a generative kind of set of eyes rather than a kind of negative deficit-based focus. So traditionally and biologically as human beings, our brains are set up to always be looking for the danger that's out there. It's the natural kind of human way of being. It's part of our limbic system, that kind of pre-evolutionary part of our brain that says you need to be looking over your shoulder constantly because the saber-toothed tiger might come and get you, or the other tribe of Stone Age people might be about to club your back of your head in. And our brains haven't evolved from our limbic system to that point where we naturally recognise that we are the apex kind of predator now. We don't need to worry about being preyed on by others. And our brains haven't quite caught up with that. So Appreciative Inquiry is a way to help our brains to catch up with that different kind of place that we've got in the world, and to help us to recognise that if we always look for the negative, which is what we kind of traditionally as human beings do, we'll always find the negative, and you'll always be able to find the negative in any situation. Whereas if we switch the way that we look at the world and we start to try and find what is good, what already exists that we can grow on, and what can we make even better, it helps our brains to switch into that place where we can look with a more generative focus and start to ask the questions that help us to kind of really rapidly move forwards with improvement and with developing change ideas, because we're coming from a place of what can I grow from rather than what's wrong. So we talk about what's strong, not what's wrong. And I think that's a really kind of key message of Appreciative Inquiry. So yeah, whilst there are tools and techniques that you can use, it's not a set of tools and techniques. It's a way of looking at the world and a way of thinking differently and a way of accessing the good that is already there.
I think that's so interesting.
Because otherwise,
do you know what though? I think that was a really condensed way of talking about it. Because like you said, you could talk about stuff like this for so long, and I think that aspect that it's not just, you mentioned at the beginning about it's impacted your whole entire life. It's not just your work bit. And I think that's so interesting in terms of how you do view the world and, kind of how you do kind of view the day-to-day stuff, as well as then how important searching for the good is within the healthcare settings as well.
Yeah, definitely. I think we've had years and years of being told that the NHS is broken and it's unfixable. And actually, from all my experience, and I'm sure Katy will agree from all her experience as well, yes, there's bits of the NHS that, absolutely could be better, but the NHS is not broken because the people in the NHS are passionate and want to do the best. And while that's still the case, the NHS will never be truly broken, I don't think. And if we look at what's going really, really well, then we can help people to move forwards to a space where they can make that thrive and really bring that joy in work for themselves and for patients as well.
Yeah, it's that human element as well, isn't it? And with it being a mindset thing as well, it's such an important thing that we can kind of like get people to realise this as well. So I think that kind of brings me really nicely onto that, Katy, I kind of want to touch a little bit on, the impact of celebrating, the strengths and the positives and how that can positively impact staff, and then consequently move into kind of that, that sort of improving patient care side of things.
Yeah, there's something we feel really strongly about, and we wanted our podcast to be able to start to tell the real stories of health and care staff. where they had built from the strengths that they had already identified, and then made things better for both health and well-being of staff and patient care. And there's lots of studies out there, there's lots of articles, there's lots of research, including the Civility Saves Lives campaign and also the Learning from Excellence, where if you are up against continually only seeing the deficit based of staff or the care that they deliver, it has a negative impact on patient care also. So you'll have staff members who feel that they can't raise concerns because they've been treated in a certain way. And also, it's the great unspoken talking about good healthcare and great healthcare and appreciative healthcare. Therefore, our structures that have been built in the NHS have been built in a deficit-based approach to either, if things go well, great, crack on to the next thing. But if things go badly, we will focus on that to the nth degree. And that's right. We should be focusing on that when it goes wrong. That's what we owe to our patients and carers and staff, definitely. But also we owe to our patients and carers and staff when it goes well. And when we start to focus on what goes well, you will start to recognise the joy in work. You will start to recognise that there are really amazing, it's called positive deviance, but you've got people in healthcare that are doing things in a different way, that are getting better results. And we're not noticing that because we've not built structures to study it. So looking at how to celebrate staff not only helps their mindset and also recognises that we are appreciative of the staff that come into work every single day, despite parts of the NHS needing work, despite them witnessing sometimes really hard shifts, really distressing situation. They are coming into work continually and delivering amazing care. So because we are focusing on what those staff are doing well, they can start to build on those strengths to improve that patient care as well. So, and it's a joy to do it. We are talking to health and care staff that are studying what their teams are doing really well, and they are wanting to engage with that process, and the patients are feeling the benefit of that, the positive benefit of that. We have examples, numerous different examples of where patients have improved their condition, got home earlier. They have been involved in different art classes, different therapeutic exercises, numerous different things where all the team are involved. And it does link in with part of Appreciative Inquiry's wholeness principle, where you look at what all the team are doing together really well and how they can build on those strengths together, and looking at every single person in that room and how they can improve that patient care, including the patients and the carers. So it's exciting to be part of that.
It's amazing as well, isn't it? I think it's that, that when you're in kind of a positive place and you're seeing that impact of doing something positive and realising that, people are recognising that those aspects of good care, you all kind of, it's almost snowball effect amongst the team as well, isn't it? You kind of all bounce off each other as, people feel better, therefore, the endorphins are better and all that kind of stuff. And it just sort of, you can imagine as a team that are all, their primary focus is to care for someone. The more they see that kind of having an impact, then the better they're going to feel about themselves, and therefore, the next person that they're caring for and the next person and everything else.
Yeah. What I say when we do little teaching sessions on this, or when we talk to different staff members about Appreciative Inquiry, I usually say that there's a trigger warning. You will feel deeply uncomfortable with talking about the good, that you will feel that what's the point in us focusing on this? I've got too much to do. But when they start to trust that process and have permission to have the time to look into what's going well, it is a snowball effect. And people start to say, well, why have we not been doing, or they'll say, why have we not been doing this? Or they'll say, oh, I have been doing this for a long, long time. I just didn't know it was Appreciative Inquiry. I've been focusing on this because it was the right thing to do. It might not have been built into our record keeping or into what I need to feed up to the matron, but we have been doing this as a team because this is good teamwork, So it's exciting to be part of that snowball.
Well, I remember when me and you, Katie, had that initial chat before we kind of, decided on the podcast and things like that. And we were talking about something we'd done as the marketing team had done at Radar. And I was just talking about it because I'd literally just implemented something. And you said to me at that point, you were like, you've just done Appreciative Inquiry. So I think you're right. I think it's that getting across that actually there is a term for it almost. It is such a good thing.
Yeah, and it's everywhere. It's not just health and care, but health and care are the ones that are the most complex and also very, very focused for understandable reasons on that deficit-based approach and what are the problems and what do we need to fix and what's broken and how do we fix that. So getting that within health and care, seeing those glimmers of joy, it's really, really important, especially at the moment with the NHS. The staff are coming into work, seeing a lot of different things that are really distressing, but they are getting enjoyment from caring from those patients, and that needs to be amplified and lifted every single day.
Yeah, definitely. And I think that comes on really nicely to chat about a little bit about Kayleigh, I'm going to come back to you a little bit in terms of what are the challenges that some of the professionals within the NHS might face around this, and how can they overcome them? So is there any kind of tips or best practice that you think people could take away from listening to this in terms of that change in mindset a little bit?
Yeah, so I think in terms of the challenges that we face in the NHS with this kind of mindset is that all of our systems, as Katie's kind of alluded to, all of our systems are naturally based in a deficit-focused mindset. What's broken? Who have we harmed? How do we fix it? How do we stop that from becoming a litigation issue and kind of nip it in the bud is possibly the wrong phrase, but and it's very, very difficult then for people to go in and be the person going, well, I know these horrible things happened, but actually can we think about what went really well in that situation? And one of the tenets of Appreciative Inquiry is that we don't ignore that there's problems in the system. It's absolutely not about kind of pretending that nothing ever goes wrong. But it's about thinking, okay, that thing happened, but then will still be some good that we can pull from that. There will still be, however bad the situation was, there will still be a part of the team that operated really well, or caregivers who've given an incredible experience to that patient, regardless of the outcomes. And it can be very, very tricky to kind of flip that switch with people. So we're seeing that the conversation is changing as more and more kind of young people are coming in from school and from college and university, where a more appreciative mindset is being taken in lessons. We're seeing that natural kind of switch start to happen because people are coming into roles with more ability to do that mindset switch. The bigger kind of challenge that we have is with staff like myself and Katie, who've been in the NHS for 20, 30, 40 years maybe, who have become ingrained in that deficit-based way of thinking. And what I say to people when they're first starting out with using Appreciative Inquiry is start really, really small. And it's the same with improvement. Don't kind of try and roll out an Appreciative Inquiry framework for the whole trust or the whole organisation immediately, because you will have people feel deeply, as Katie says, deeply, deeply uncomfortable with that because it's not part of our psyche. So if you look at America or Canada and the way that they do Appreciative Inquiry over there, not just in health, but generally, it's much more natural for them to speak in that positive way and that way of talking because that's part of their psyche as a nation. They're very, very positive. They're very, very kind of ebullient in talking about their own strengths. Whereas, I don't know about you guys, but I certainly growing up was always told, nobody likes a braggart.
Yeah.
Don't talk about how wonderful you are because you'll just make people cross. And we're kind of brought up with that mindset of it's almost better to be quiet about your successes and not to celebrate them. And what Appreciative Inquiry asks you to do is actually, no, really shout about the incredible stuff that we've done, because if we don't celebrate our success that we're achieving in our work, we can't expect that other people will necessarily know that we've had that success. And a part of improving health and care is about learning from each other and learning from the experiences that we've all had. So if we only share the negative experiences, we're only going to hear the negative side of healthcare. Whereas if we get better at sharing those positive experiences, whether they be big wins or small wins, it naturally starts to change the conversation. And I think with all of the media coverage of the NHS for the last 7, 8 years, but kind of really specifically lately, it's all negatively focused. And we're never going to be able to change that message that gets out to the wider population, the general public, if we're not celebrating our successes. So we need to start, and I don't mean we as in us on this podcast, I mean we as in every single member of staff within health and care needs to start talking about the successes we're having and those great patient interactions and those great patient experiences that we create day in and day out. But all of the patient safety documentation, knowledge, evidence tells us that things go wrong in, I think it's around 0.08% of patient interactions. If that's all we're ever talking about, we're missing learning from a massive 99.04% of cases. And we're doing ourselves, the health service, a massive disservice by not talking about those examples where it goes really, really well. But in terms of kind of people looking to implement appreciative inquiry or change their mindset, start very, very small. Ask a different question in a meeting. So one of the case studies in the Appreciative Health and Care book that Katy mentioned, and I'm sorry, Katy, I'm going to make you blush now. One of the case studies in that book is Katy asking just for a little brief pause in a meeting. So it was an after-action review at a trust that had been in critical incident and had kind of major pressures on ED. Doing an after-action review, as we do in all of these kind of incidences, and the after-action review was very much talking about what's gone wrong, what were the things that happened that led us to that. And Katy very bravely in that kind of senior level meeting stood up and said, actually, can we just think about what went right? Because we had some incredible patient experiences. We kept people safe despite the fact that we were busted at the seams. What did we do as a team that helped us to achieve that? And it's a very, very small intervention, isn't it, Katy? But hugely changed the tone in the room and the conversation that happened. And actually, the people left that room able to go about the rest of their day with a spring in their step and a zing in their attitude, because they felt like they'd been able to celebrate massive successes in a real kind of pressured environment. So just ask slightly different questions. Bring it in very, very gently. Don't kind of show up and all singing or dancing with cymbals on your hands saying, shall we do a full appreciative inquiry? Because you will have people run out the door. But just ask a slightly different question. And when people start to go down that deficit-focused kind of trail of conversation, just pull people back gently and say, actually, can we just think about how we've worked really well as a team today? Or what strengths do each of us bring that's helped us to get through this shift and not have any incidents? And as you've mentioned snowballing, the speed with which that conversation changes and becomes a positively focused conversation leaves me astounded every single time, because people want to be able to recognize the good stuff. We just don't feel like we're allowed sometimes. And I think what Katy and I are trying to do with the podcast, and I think Katy said it in every single episode, you don't need permission to do this. You are your own permission to kind of say, actually, this went really well today, and I'm really thrilled that we were able to achieve that. So just start really, really small. Don't expect it all to change in half an hour. It's taken me 2 years where I am at the moment to start a really rich conversation about how do we embed appreciative inquiry. But when it happens, boy, does it happen.
I think that point about, just asking a slightly different question and the fact that you don't need permission to do it is something everybody could take away, because you don't have to, some of these things have to come from senior leaders, for example. They have to come from the very top to be able to start implementing them, and that's really difficult. So I think what's really nice is with something like that is, it could be, a team lead or something like that that's just in a meeting that starts to kind of have that little bit, those little baby steps that then might, somebody else from that meeting might take that into another meeting that they're in, or however it might work. So I think almost having that ability to kind of say, what did go well, how did we work well as a team, those little questions that actually have a positive impact are something so easy to start and weave in a little bit more.
Yeah. And so where I first picked up Appreciative Inquiry, when we had our initial training, the first and only thing we did for a little while was in our team meetings. We started every team meeting with what's gone really well this week? And everyone around the table answered that question. And we noticed very, very quickly within 1 or 2 meetings that our whole mindset as a team in those team meetings completely changed, because we were starting the meeting up with something that we were proud of. And that then meant that all of the tricky questions around where does our budget go and where do we, how do we impact on quality metrics became much more kind of positively focused, because we were all in that headspace of we can absolutely do this because we've got so much there to be proud of. And what you said there around it doesn't have to come from the top, I think is really, really key with Appreciative Inquiry and the episode of the podcast that we've just recorded a week or so ago. We were talking to Suzanne Quinney and Tim Slack of Appreciating People. And that's exactly what they said. So they've been working with Appreciative Inquiry for 20 plus years,
Wow.
and working in the health space for 10 years. And that's exactly what they said. Wherever they've been to organisations where they've tried to do Appreciative Inquiry with a top-down approach, it's not worked as well as places where it's a couple of people with a real passion and a real belief in it, driving it from the kind of front line of organisations. And then the rest of the organisation kind of naturally falls into that habit because you're having those different conversations. It's not a toolkit and a framework that you can just pass on to an exec board and say, there you go, implement that in the organisation. It has to be really genuinely and honestly led from the people who are kind of delivering that work, doesn't it, Katie?
Yeah. It has to build and build. It has to come from the frontline workers who are seeing that every day and feeling that every day. That doesn't mean to say that you can't have exec members or CEOs that are implementing Appreciative Inquiry and very interested in appreciative governance, where you build the structures to allow the right questions to be asked. But the real powerful moments are from those little stories of individuals taking a different stance and a different mindset.
Yeah, I mean, to kind of bring it back a little bit to the clinical governance side of it, and the frameworks, that we've mentioned that obviously Appreciative Inquiry is not a framework and it's not a set of tools. Obviously within NHS we've got PSERF, we've got after action reviews. I know you touched on those earlier, Kayleigh. How can kind of Appreciative Inquiry link to those, and how can they all kind of support each other in kind of being sort of more successful when it comes to that patient safety side of things?
Yeah, good question. But there's a lot of different overlap within patient safety and clinical governance and Appreciative Inquiry, especially since the Patient Safety Incident Response Framework came into play. And there's a reason why myself and Kayleigh got on so well way back when with a head of clinical governance and a head of continuous improvement. It made sense because actually with clinical governance without improvement and without that appreciative stance and without looking at, well, what are we going to do about that then? How can we improve upon that? Is just a cattle market of looking at incident after incident after incident. You've got to continually improve from that stance or you'll go crazy. But Patient Safety Incident Response Framework allowed us to start to look at what it's called Safety 1 and Safety 2. And Safety 1 is where we're looking at what's gone wrong, what has broken, what do we need to fix, what incidents have happened, what complaints have come through the doors, where do we need to put things in place urgently to improve that patient care. And that needs to remain, and that is incredibly important in health and care. Safety 2 is talking about what Kayleigh was talking about before, in if we're looking at, even if we said a really generous 10% of patient care are incidents and complaints. Let's do a really generous 10%. It's not 10%. That's 90% of patient care that is not incidents and complaints, and we're not focusing on that. Now, Safety 2 looks at what is the work that is done every day, not what are the things that are going wrong, how are people delivering care, and how are people delivering care well, and how are people delivering care so that those patients go home or those patients improve. And that is being built into patient safety. So one way that that's being built into patient safety is after action review. And I know that you've had Judy Walker on What the HealthTech, who I've been taught by Judy Walker, and she's amazing. She's doing a lot of amazing things with after action review in patient safety right now. After action review can deliver that appreciative inquiry, because it is the wholeness principle that I was talking about. Everyone that is involved in that incident is in the one room, and everyone has a voice in that room, and it's a non-hierarchical process, so that everyone has the same amount of time to go through the same questions. But one of those questions in that after action review can be, what went well? We could be asking, what did you expect to happen? What actually happened? What was the difference? And that difference could be what went well as what went wrong. So there are many different tools, and the SEEPS model as well. So human factors involvement in patient safety is a massive, massive win. And human factors within patient safety is looking at all those different performance variability of staff caring for patients. Most of the time, staff are creating positive performance variability despite what policies are in place, despite what resources are in place, despite if they've got lack of staff. They then look at a situation and go, right, what can we do right now then? With this. Right, we'll deliver this in this way then. Right, we'll change now. We'll change to this. We'll change to that. We'll deliver it in this way. But that's not measured. The only time it's measured is when something goes wrong, when they are making those decisions with that tight time frame. So appreciative inquiry in patient safety allows people to look at the strengths they have in teams that can then keep patients safe. The other side of the coin, when have patients not come to harm? And why have they not come to harm? Or when patients have come to harm, what has happened around them that changed in that day that the day before was fine? What happened the day before compared to what happened that day? It doesn't take away the ask of what went wrong, and it doesn't diminish the importance of looking at when patients have come to harm. It adds that dimension to look at, well, how are we going to sustainably embed something that will continually keep patients safe? And it does it in a way that allows psychological safety for staff. Because when you've been a second victim in an incident, when you have either witnessed or been involved in an instance as a staff member, and I have been that staff member, and I've been involved in incidents, and I've used that in my teaching sessions, it is horrifying. It is an awful, awful process to go through. And if at least your voice is honoured and you are involved in that process, and also not only are you involved in an incident process, but on the same week or the same month you are celebrated for some amazing care that you've delivered, or you have been recognised for, say, 19 years of amazing care, you've only had one incident you've been involved in, you've cared for thousands and thousands and thousands and thousands of patients, it feels less heavy on your shoulders. And I'm very interested in that second victim process. And it also has that positive impact on those patients, because in appreciative inquiry, you are involving the patient voice. So you're involving the patient voice, the carer voice, the staff voice, the community voice, everyone that is touching on that care to then find out how can we build from the strengths we have. I hope that helps.
I think 100%, yeah. And I don't know what your thoughts are on like the terminology of things as well. I know you'd kind of mentioned earlier, Kayleigh, about, asking the different questions and things like that. I think, we've got people that use our system that some of our partners, instead of calling things a near miss within their kind of processes, they call it a good catch. It means exactly the same thing. And I think it's so interesting because a near miss sounds like, oh no, we should have caught that, we should have done that. But a good catch is, do you know what? How good is it that that got spotted before it caused harm? And I think it's such an interesting way of looking at things, because going back to the very beginning where you said, it's about a mindset thing, it's about kind of seeing the good, searching for the good things. Things like that, the terminology of how you kind of what you call things in some of these like kind of audits or forms or, reviews and things like that, I think are super important in terms of helping to change that mindset to that slightly more positive look.
Yeah, definitely. And that's where we can start to build a clinical governance or a continuous improvement structure that allows appreciative inquiry to seep in. Part of the example that I'd given in for the Appreciating Health and Care book was building a mandatory field into an audit that said what went well, and looking at that you couldn't get past. You couldn't get past that mandatory field without putting something in. So to put something in, you had to go looking for what went well in that patient care, and you'd find it. Because if you had a question that said what went wrong, you'd find that too. So, and words create worlds. So when you're asking that deficit-based question, you'll find a deficit-based answer every time. If you ask that generative question, people will start to think in a generative way. It's a gift that you can give, especially building into a structure, definitely.
I want to touch a little bit on the book, actually. So, Kayleigh, we've talked a little bit about getting this information out there, getting more people involved in appreciative inquiry. You mentioned earlier it's not about a few people doing it; it's about getting everybody involved in this. So. We'll touch a bit on your own podcast, but I know Katie's just mentioned the book. So can you tell us a little bit more about kind of how you've been involved with that?
Yeah, so the book has been 5 years in the making. It first came about, and it was slightly before my involvement. It first came about at an Appreciative Inquiry World Summit, which was held in Nice in 2019. And there was a session on learning from excellence and appreciative inquiry. That got a standing ovation, that had everybody in the room kind of whooping and clapping, and there was poems written about it. And appreciative inquiry practitioners are a very creative bunch, and the book was kind of born there. It was a conversation between Suzanne and Tim at Appreciating People, who I've already mentioned, and Dan Hodgkiss, who works in Health Innovation West Midlands and is another appreciative inquiry practitioner. And they said, you know what, the time is right for a book specifically about health and social care and appreciative inquiry. There's all sorts of general appreciative inquiry books out there. But we've always kind of found that health is, we say this all the time, but health is slightly different because we are complex human beings working with complex human beings at a time when those complex human beings are potentially going through some of the worst times that they've experienced. Someone's been diagnosed with a really serious condition, or is in hospital with a broken leg and terrified and in pain. So they decided it was time to kind of create this book. And that's where Appreciated Health and Care was born. I came into the conversation probably 3 or 4 months into the kind of decision. They decided that they wanted to get some extra partners in. So they brought in my old organisation, which is AQUA, which is Advancing Health and Care. And they wanted to bring AQUA in as other kind of appreciative inquiry practitioners working in the health space. A little while into us planning and writing the book, a small thing called the global pandemic happened, which did set the writing back a little bit. But actually, to reframe that, and reframe it as a big part of appreciative inquiry, in terms of the book and in terms of the richness of experience in the book, actually the global pandemic was a real boon for appreciative inquiry in healthcare. because people were having to work in a totally different way. People were in deeply unusual and challenging situations. And what we started to see is that actually people naturally gravitated towards a more generative way of working. When all of those structures and kind of red tape was stripped back a little bit. And I know we all went into command and control and things became very, very top-down driven. But at the very start, teams were kind of encouraged to kind of think of ways that they could get around this, think of ways that they could work, ways that they could adapt their clinics and their appointments and their treatments to become online, so we didn't have to get people face-to-face. And that naturally led people down an appreciative inquiry route, because you weren't asking what's going to stop us from doing this. We were asking, what can we do that makes this possible? So very naturally, appreciative inquiry style conversations. So when we were able to get back together face to face, and we went for a writing retreat, which happened in a lovely cottage in Scotland with Highland cows in the back garden. Like, it was the most beautiful weekend. Incredible. Like, going out after doing a full day writing and going out and stroking a Highland cow was just a beautiful reset. But we got together and we started doing this writing, and we said, right, well, we need to get some case studies. This can't just be experts telling people how to do this. And so the beautiful quote came out of our recent episode is that everybody is wise and everybody has that level of wiseness if we let them share it. So we decided we wanted to go out and hear about the level of wiseness in health and care. And we thought we'd get 1, 2, maybe 3 case studies, and we'd really have to pad them out a little bit for the book. We had to create a second book just of case studies to be able to fit all of the case studies in. So there's 15 case studies in the book. There's a separate ebook with 8 additional case studies in. And then there's like mini case studies threaded throughout the book as well. So it's a really practical resource that shares, how do you do it? How are people using appreciative inquiry in health and care settings and seeing real demonstrable results with it? So it's a very practical resource. And it's probably professionally the thing I'm most proud of in my career. I mean, I've got my name on a published book. That's always a bonus. But it's a book that I think has really got the power to help us to change things in health and care. So since the release of the book, which came out in April, we know that the Care Quality Commission are starting to look at how do they build appreciative inquiry into CQC inspections. We know that the patient safety collaboratives, so there's 15 patient safety collaboratives nationally, they're starting to look at how do they build the patient safety frameworks in an appreciative way. PSERF that you've already mentioned is a much more appreciative framework than what went before it. There's a lot more opportunity to share the good and to really kind of focus on the things that are important to individual organisations rather than that nationally set, these are what you must let us know about. We're seeing care home consortiums really kind of pick up appreciative inquiry and use that to help them to guide the way that they engage with residents. So we're starting to see real national uptake of this kind of mindset as well, and that being embedded in national pieces of work, which I think we thought would take a lot longer than it has. We thought it'd be like a couple of years before we started to see real impact at a national level. And I think we as a group have been astounded by actually how quickly that's happened, which shows how actually the delay from the pandemic that meant that we kind of released a year or two after we wanted to has meant that we've released at exactly the right time when it's ripe and people are really ready to start embracing this. People have come out of COVID we've all come out with a slightly different mindset, haven't we? Actually, you have to make the most of everything that we've got, because you never know when something like that's going to come along again. So the book's come out at that perfect time where people are ready to kind of take that on board and do something a little bit differently, I think.
Yeah.
I totally agree in terms of, I've been at Radar 3 years, and in the time that I've been here, the difference I've seen in terms of people going from talking about, the good to actually putting something in place that helps them to learn from it, and something a bit more official, has definitely changed. I'd probably say definitely within the last year. And we've got, like, we always encourage, as part of our system, we always encourage people to kind of learn from the good and record the good and that kind of thing. But you kind of mentioned with like the care homes and things as well. We've got lots of customers and partners that are like multi-site, and one of the things we've definitely noticed is, by recording the good in one particular location, other locations can then learn from things that they've input that others aren't so good at, and it kind of helps that mindset like across different locations as well as different teams, and that snowball effect isn't just within one particular home, for example. It then starts to flow across all the different locations and the different sites as well.
Yeah, 100%. It's a really, really powerful tool that once people start using it and people start seeing the benefit, it kind of runs away with itself in a really, really positive, really nice way. Not often that you say something's run away with itself and it's a good thing, but in this instance it is. It's one of those, I work in improvement and have done for 10 years, and improvement through the traditional methodologies, and probably the same with governance, Katie. It's one of those things where you have to kind of constantly be going to people and saying, where are you up to? Have you done this? How's this project going? How's this investigation coming along? When you're using an appreciative mindset and an appreciative methodology, you don't have to do any of that, because people are so enthusiastic that they manage it themselves, and actually you're swamped by going, I can't keep up with how much people are telling me about how well things are going, which is a beautiful place to be in, especially in the careers we've both had, isn't it, Katie? It's a very different way of dealing.
Yeah, it's addictive. Yeah.
I can imagine, definitely. Yeah, so I was going to say that must be a lovely spot to be in, as opposed to like having to actually, kind of go and search for it and everything else.
Yeah.
Katie, I just want to touch on as well, and we've chatted about the book with Kayleigh there, but you guys have got your own podcast, Caring Corner, and this focuses on sort of sharing the stories around appreciative inquiries. Is there anything you've kind of discovered from doing the podcast that has surprised you, or kind of has sort of shocked you in any way, or anything like that since starting it?
Yeah, we learn so much every month, I think, and it's still in its infancy, but it's so exciting to be a part of. The dream that we had, really, it's a very small dream, but again, with Appreciative Inquiry, we can start with a small dream, is that we would have some stories directly from health and care staff that would show that Appreciative Inquiry is really accessible to all. So, I pictured, I always say this one story, but I had a healthcare assistant when I worked on the wards who brought a certain type of tea bag in for a patient because they didn't want tea from any other tea bags, and she brought them in from home. That's an appreciative inquiry, and that made that patient more comfortable in that stay. Potentially could have had a positive effect on the growth and their improvement. That's an appreciative inquiry, and that's something that people are doing every single day. I have a nurse that will bring a blanket in from home from a patient who has continual low temperature because she doesn't feel the blankets are thick enough in hospital, so she brought one from home. But that's not talked about. But it is on our podcast. So what did surprise me was that people come on this podcast who have never been on podcast before, and will start to be nervous talking, but then we'll do a little appreciative inquiry in the episode, so they'll start to kind of reflect on the processes and reflect on how the appreciative mindset has been. And you can see them starting to build in the conversation what they're going to do next, especially when we ask, what's the future to appreciative inquiry in healthcare? Every answer is really eloquent and is an intention setting. So people know what they want to do next, and people want to come back and tell us about it. So it's really exciting it's so substantial, it's so robust that we've got the outcomes. And we talked in episode 1 about yes, we have the quantitative data to show that patients got home quicker. But seeing that patient sat upright in their own clothes in an art class that then was continued when they went into the community is more the powerful outcome for the patient than all of this data that is actually going to be reviewed. So they can build from both qualitative and quantitative data used in appreciative inquiry, which I am always excited about. It's just the power of people and the power of stories. I'm very, very addicted to that. And it grows legs when people hear those stories and go, oh, I did that last week. Or I can do that tomorrow. Or, well, that is doable. And that is something that it's cheap as chips. You know, you don't need to then ask for funding to then start a training course. Well, what we talk about regularly is Kayleigh is incredibly well trained in appreciative inquiry and has been training people for many years. I am not. However, I have a passion for it and I read about it all the time and I work within it. But you don't need to. You don't need to have a degree or masters in it. It's a mindset. It's a social movement. It's a powerful force where you just from that question, can we just focus on what went well there as well? That's all you need to do, you know. So those conversations and how powerful those conversations are in a health and care setting continually surprise me. Yeah.
I mean, I agree with you in terms of like, you know, hearing people's stories. One of my favourite things about doing this podcast is the amount of people that we've spoken to that work in health and social care, the amount of passion and positivity and optimism across the industry is incredible. And especially when, you know, we mentioned at the very beginning that in the media, all you hear is negative stuff. And it genuinely is one of my favourite things about that we get to share those stories with different people that might not hear them. And I think it's exactly the same from what you just said about your podcast. It's, you know, sharing those little things like the tea bag thing is amazing. You know, everyone knows how important it is to have a good cup of tea, for example. So I think to hear those stories and for other people to listen to those and go, oh, actually, we could do that and it's dead easy.
It is. I'd like to say it's not easy and we put a lot of time into it, but it's genuinely just asking different questions. It is as well. It starts from that anyway. Yeah.
It takes a lot of time. I definitely get that bit. But yeah, so I think sharing those positive stories and that optimism is so important. So yeah, we'll what's it when we'll put the sort of links to your podcast and to the book and things like that when we put the episode out, so anybody can kind of go and have a listen as well and hear those stories in a lot more detail, which I think is fantastic. So I just want to kind of my final question for, I think maybe for both of you, is kind of what do you think the future is of patient safety? Or, you know, we've talked about, you know, the dream, the small dream that you start with. What for both of you is kind of the future of where you kind of want to see things going?
Can I take this first, Kayleigh? Is that all right?
Absolutely, Katie.
So I have thought about this, obviously, because I'm an absolute patient safety geek. So Suzette Woodward had said on the Learning from Excellence, in fact, Being Better Together podcast recently, and she said it in her books, that patient safety had been focused on the description as being the absence of harm. But patient safety is actually patients being safe and going home safe and improving their care. So I think the future of patient safety is that we look at all of those elements of a safe patient, not just an unsafe patient. So I think doing that will then point towards the patient safety incident response framework actually being enacted as it should be, with a change of culture, looking at all the different aspects of health and care, and then a celebration of when that health and care has delivered, not just when you've got a patient's pet horse to the deathbed. Actually, when they have delivered the care that they need to deliver, that is an amazing thing. You are allowed to talk about that. That's not just it's a given. That is amazing. And it's amazing every single day. And it's amazing every single hour. And that's what people come into work for. So I think the future of patient safety is to look at all of those aspects and to then grow from what we've learned from that.
Amazing.
Yeah, I couldn't agree more, Katie. And I think that moving from the absence of harm to the presence of safety, that's the kind of ethos of safety too, isn't it? And I think it's also the ethos of the future of patient safety is that, as you say, if we move from a place where we're only looking at what goes wrong to a place where we're really cognizant of every single element of that care and what goes into it and what goes really well, and how people, because that's what, at the end of the day, we are all people, whatever our role in that care is. We are all human beings trying to do the best by other human beings, and being really cognizant of how we all bring our strengths to every episode of that. And it might be that in one setting, my strength is different to another setting, but being able to understand that, recognize that, and work together as a whole holistic team of people, not of roles, is the future of patient safety. For me, it's how do we work best together to give people the best possible experiences in the safest possible way. And that is the kind of appreciative ethos of it to me, I think. And there's a lot of kind of drive nationally in a really positive way at the moment around how do we get a different patient safety message out there. So I was at a conference on Tuesday, just a kind of regional conference, where they were celebrating the success of the NHS Impact Framework so far. And the message from that was, we want to be the best, the most improved, most safe healthcare setting in the world, not just in the country. We want the NHS to be the most improved, most safe healthcare setting across the globally. And I think that's a real shift in the language that we're using. We're not saying that we want to improve by 10% or we want to catch up with other people. We want to be the best in the world. And that is the future for me, is that real kind of generative statement around that's where we want, that's our aim as a whole NHS, to be the best globally. And I don't think you can set a higher, more positive focused aim in terms of patient safety than that.
I think both, I mean, they are such strong points, I think, to end on. And I think there's lots that you've both said within this podcast so far that, you know, people can take away, whether it's something really small, whether it's something a little bit bigger. I think there's lots in there that people can kind of take away and hopefully try and implement across their own organisations, which is fantastic. So thank you very much for sort of going through everything. I know there is so much more we could chat about. There is so much to go through in terms of this, but I think that gives everybody a good overview of the Appreciative Inquiry, how it can help within the organisations, and in particular within health and social care, which is fantastic. So at the end of every episode, we always ask a little question about what the HealthTech moment is. So this started off as a bit of fun, as a way to end the episodes, and we've heard across however many episodes we've done now, we've heard the weird and wonderful stories, we've heard emotional stories, we've heard life-changing, we've heard funny, and obviously you have both been within the NHS for over 20 years, as you've mentioned. So I'd like to ask both of you what the HealthTech moments are, please.
Oh, do you want me to
let you go first again, Katie?
So for one of I have many different stories from my health and care days, but one of the moments was I was a ward manager on a general medical ward, and it was my first week as ward manager. And then we received a patient who had got a handover that they had mental health issues, and that they had an infection control issue, and that they needed a side room, and that they needed one-to-one care, and they needed security presence at all times. And this patient was in the 60s and had been in one of the members of the prison riots, the local prison riots in the 80s. And they were an absolute character. But the handover only said aggressive, tendencies, one-to-one care, needs security presence. What they didn't say was that he was a poet and he was a singer and he would sing a top belt at any given moment. He was astute and he was sensitive, and he would tell me the good staff on my ward and what they would do at any one time. He would give me feedback on different care that he has received. He would also chuck jambottis at me, but he was a complex, sensitive, beautiful character. And that is linked to Appreciative Inquiry, that actually you need to see all of the aspects of that person and what strengths that they bring. And the poems that he wrote still stay with me. And I memorized one. So he was a character. It was a trying time for a first week as a ward manager, but I will always remember that patient and the jambottis that I had to dodge.
I love that. That's an amazing moment.
That is the most northern story I've ever heard with jambottis in there.
Utterly northern.
I'm
sorry. I'm unapologetically northern, as you know.
I'm not quite sure, as a non-clinical member of the NHS, how to follow that really. But I think for me, my and it's probably a slightly more flippant, not deeply moving like Katy's story, but my kind of the memory from my career in health and social care that sticks with me and always will stick with me. So before I moved to Aqua, I worked for another health improvement organisation that sadly no longer exists. It became part of Aqua a number of years ago. And we ran a conference looking at the Charles Vincent measurement and monitoring safety framework that some people might have come across. And as part of the conference, we had an evening speaker that was the chief medical officer at Wigan Warriors Football Club. And he brought with him two of the players from Wigan Warriors. That was Michael McElroy and Josh Charnley, who weren't allowed to speak. They were just there as the muscle to provide this medical director with some. I definitely worked for a rugby club. But my abiding memory that will stick with me for my whole career is I worked at the head of comms at the organisation. Was still is a tiny, really slim lady. And it's one of the photos I look at on my phone whenever I need cheering up, is a picture of her lying across the two rugby players in their arms, and just the biggest grin on her face, because it was the most joy she'd ever experienced in a working environment, was being held aloft by these two rugby players at an NHS event. And I think it was like the lead picture that we went with on the event comms as well afterwards. And it's a silly little thing, but it's always stuck with me as it's not that hard for us to create the best part of someone's day, just in a really, really small way. And every 6 months or so, we still send each other the picture backwards and forwards. They did not pick me up. It's safe to say I am not as lithe and small and slender as she is. They took one look at me and went, "Are you all right? Thanks." But it's a really, really small thing. But that's 10 years ago. It still sticks with me now. It still brings a smile to my face. And I won't talk about what happened at the disco afterwards. But yeah, it's always the inappropriateness of some of the songs that if people felt were appropriate to put on with a room full of NHS chief executives. But actually, that was a very bonding experience for everyone who was in that room. That little moment of what on earth is happening in the corner over there. And it completely changed the way the rest of the conference went, actually, because everyone felt so much more comfortable with each other after all bonding overlapping at this poor woman being picked up by the rugby players. That we had a totally different day two of the conference, and the conversations completely changed because everyone was at ease with each other in a way that they hadn't been before. So those little things that don't feel important can be massively important. So that's my kind of thing that stuck with me, like what the HealthTech movement, how you can change a conversation with rugby players.
I love it. And do you know what? That is exactly why we love asking this question, because you hear stuff that is completely, you'd never guess that was what you were about to say or anything like that. So I think it's so nice to hear these stories and to kind of hear the bits that, like you said, the bits that stick with you, basically. So thank you so much, both of you. Like I said earlier, I think there's so much people can take away from this episode, and we'll link to all the podcast and the book and anything else that is a good resource for people to start and implement Appreciative Inquiry. And thank you to everybody for listening. Join us next time for another brand new episode. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.